No, it's not. What happened is the first couple of days, but then I had to put the brace on again.
Okay.
Because it was still hurting me. And the doctor, I just came from my podiatrist.
Okay. Right foot. Your left. Your
right
left.
foot. The right foot is actually the worst one.
Yeah. Well, it looks like the left foot is a lot more jam packed. You can see it over here. There's no spacing in between this versus on this side. You can see that there's a little bit of gapping here. You see that little gray area?
Yeah, yeah.
Watch this side. We go over here. Can you even see that? It's not visible. The right ankle first, okay?
Okay. So you're gonna get the ankle and the what do you call that?
Plantar fascia. That's all underneath your foot we're gonna do.
Yeah.
So we're gonna start working on John's ankle and plantar fascia. He's been having a lot of pain in this area, so we're gonna try to give him some relief. 3, 2, 1. Now, at any point, if the pressure's too much, just let me know, okay?
Okay.
The plantar fascia is underneath the foot. It's a tough material that is like built with all these these tendinous fibers. What fascia is basically connective tissue. How's that pressure, okay?
Okay.
All right, I'm gonna go a little bit higher now, all right? So right now we're at therapeutic dose. We're tracing the entire arch, the entire plantar fascia, up until the ball of his foot. How are we doing so far? Good. He's tolerating it very well, I will say. Very well. So it's pretty swollen in this area. So we're breaking up a lot of the scar tissue and we're allowing the stem cells to go in to do their work. Okay, you survived.
Yes.
We're gonna come to this side now.
Yeah.
Body's definitely getting overloaded with care right now. So we're gonna do about 1,500 pulses on his left side and 1,500 pulses on his right side to kind of balance him out a little bit, okay? So here comes the thunder. Ready? 3, 2, 1, here we go. How's that? This is on my neck and a little bit too because I keep bending down. Okay, okay. I guess Superman does have his kryptonite, huh? So we'll see which side hurts more. This is it. Yep. It's where your sacroiliac joint is, and basically from that point, you're kind of getting jammed up in there. So that's why walking is like the best medicine for this joint, because this is constantly moving. No pain, no gain. Let's see how your gait is, especially coming in here. You were kind of like hobbling a little bit. It's okay to feel a little bit of soreness tomorrow, but I definitely want to see, you know, how your body's moving. So let's go over here. Good. Nice, good, confident strides. And then come back this way. How's the little back feel?
Feels all right.
Less pressure, right?
Yeah, yeah,
Good.
yeah. Yeah, there's like a pressure there. And then with usually I used to go to the gym and do those exercises and
Right.
it'll go away.
Okay.
But lately it's like been lingering.
Good. Now move your hips and your legs up like this. Hands on the hips if you can. Good. Good. Any pain in the low back as you do that or no?
No.
Good. Way to go. You did it.
In like the late 70s, I got into being a car salesman, and I was walking around with those leather shoes on, you know, the European leather shoes,
They
right?
cut off
They
your
look cool.
They cut your
And
circulation
we don't
at
want
the
no
ankles, right?
arches, and I was walking around on concrete floors for years, chasing customers and cars and all that stuff like that. And you're doing that like 40, 50 hours a week over a 15, 16-year period. It was that,
That's
when
a
I got
lot.
into the 90s, somebody told me you need orthotics. And that's when I first was introduced to orthotics, you know? Better.
Behind the scenes / day in the life. You're gonna be in the two, don't worry.
No.
You, number 2.
Number 2?
The one that comes after one, but before. Don't mind him. We're gonna go right into the exam room so we can get you treated, and then do shockwave right after.
Alright. It feels much better. I'm feeling clicking, but it doesn't feel like bone to bone. It feels like there's something between the two.
Okay.
So that's progress.
That's probably some for me.
If not,
But you have to be kind of realistic and have smart goals for yourself. They have to be specific, measurable,
Agreed.
and timely manner, and reasonable too.
agreed.
So let's start face down. Scott here initially came in. His AC joint was pretty banged up. Shoulder area. What I did for him was some targeted muscle work with the body buffer as well. You can use some lotion to kind of work on that joint. And in addition, we're going to be doing shockwave for him today as well. So he's kind of getting the best of both worlds from the chiropractic side and from the shockwave side. He's 27. He's taking his care very seriously here. And the well-rounded approach is usually the best approach.
Yeah.
The body definitely needs it. Drop this. Bring your left foot out for front. There you go. Gets you every time, right?
Yeah, it does.
So you see how you're like forcing it? I got you.
Yeah.
Let it go. Sit back. There you go. Very good. All right.
Yeah.
How's that pressure? Okay.
Yeah, first one.
Good.
What number is that on?
On the highest one.
What?
Yeah.
Oh shit.
See the difference now from day one?
Oh yeah.
So I'm working on both his left and right AC joints, top, side, and back of it. You want to hit at all different angles in order to really isolate that area. All right, moment of truth. Let's move those arms around.
Oh yeah. Big progress. Little bit of, tiny bit of clicking.
Some clicking, but yeah,
Nothing
a lot
crazy.
different from like the first day, right?
Oh yeah, or way before that. Like I'm talking way before physical therapy. Oh man, I couldn't even even when my arms were in the socket, I still feel it. It was like sharp pain, you know.
And you can notice on his back too, you're gonna see some like redness. That's actually normal. That's just because we're creating a new blood flow in that area, and the stem cells are literally coming in to help fix the tissue. So, really good stuff for him. Anybody in here?